For some reason, it's not recorded. The webinar is now being recorded. So we need to start all over again. No.
Okay,
We didn't miss that. We didn't miss that much.
We didn't miss that much. So Dr. Aggie here, clinical psychologist. I conduct assessments and therapy. Olympia Megrikyan here. She's a parent autism advocate, and she provides information and guidance to other parents who have children with special needs. Did we get all of that in our recording?
Yes.
Okay, wonderful, wonderful. So let's jump into it, okay? Teresa, would you be able to skip down past, maybe let's go to the third one. There we go. That's my information. And then, or maybe the fourth one. There we go.
The fourth one.
Yes, perfect. So as you guys know, there's different types of assessments. And what I wanted to talk about today, specifically, it's called psychoeducational assessments. So what is a psychoeducational assessment? So a psychoeducational assessment, it is a psychological assessment combined with educational assessment. So it's both put together. And so basically, when we do an assessment like that, it's a very comprehensive assessment that looks at a child's social, emotional, behavioral, and academic functioning. And more importantly, it looks at how the social, emotional, and the behavioral impact the child's ability to learn. And so oftentimes we have children who have lots of amazing skill sets and amazing abilities, but for some reason, they're not able to put all the information that they have here on paper, or they're not able to perform on a test or answer questions on command when their teacher asks them. So through a psychoeducational assessment, we are able to provide a comprehensive and holistic perspective of your child's true abilities. And then once we have that assessment, we're able to share that assessment and give not only your child an accurate diagnosis, but we're also able to provide your school with information about special education eligibility, and most importantly, coming up with goals to help with your child's learning. And I'm losing my voice, to help with your child's learning. So in a nutshell, that is what a psychoeducational assessment is. And usually the process kind of looks like it's done either 1 or 2 days, or sometimes it takes one whole day, and sometimes it takes multiple days. It really depends on the child. And it's important that whichever psychologist your child is working with, whether it's me or somebody else, that they are in tune with the child and pay attention to, should the child need multiple days for the assessment, or should the child need one whole day because it's hard for them to transition back. So being aware of that and asking the right questions is going to be really important in finding the right match for this assessment process. So I get this question asked all the time. So these assessments can be pricey because it's a huge investment and it's very time consuming. Yes, you get a large 30 to 35 page report afterwards about your child, but a lot of times it's overwhelming for, just for different reasons. So who funds this? So at times, a parent can fund this assessment, but there's another avenue that a lot of our families are not aware of, and that is you can get funding through the school district to pay specifically for this assessment. And that is called an individualized educational assessment, or evaluation, IEE, individualized educational evaluation. Now, your child can get an IEE for psychoeducational assessment. They can get an IEE for speech. They can get an IEE for OT, et cetera, et cetera. So the way that it works is the school, your child's school district, is supposed to legally do their own psychoeducational assessment. They have to do it. Even if you come with your own, they have to do their own. They can consider outside evaluations, but they have to do their own. After they do their own, if for whatever reason there's parts of that assessment that the school did that you either don't agree with, do not feel like it was done right, or just as a parent, you feel like it doesn't truly capture the essence of your child, At that point, you can, in writing, request for an IEE, and then request someone like myself or somebody else who's a licensed clinical psychologist to conduct this independent educational evaluation, which then will be presented to the school during an IEP meeting. So if you guys have any questions about that, please write it in the chat and then we can answer it later on, or you can email me directly. Can we, so in the another upcoming slide, we'll have like a sample of that, but I wanted to also know what should I get from doing this assessment, right? So a lot of times parents will say, well, the school's already done their educational assessments, right? And I already have a diagnosis, so why do I need a comprehensive one that merges the two? And the answer is, if you're trying to understand your child as a whole, right, you never want to look at one aspect of their functioning. You want to look at all aspects of their functioning so you can view them as a whole being, as a complete person versus parts of what they are able to do and parts of what they are not able to do. And so Olympia will talk a little bit more about what her experience was with that, but I think it's important to get a full picture. Otherwise, what you're doing, and this happens all the time with families that I see, is families come to me really confused. The school is saying my child has autistic-like symptoms. A private evaluation is saying that they have ADHD. Another, evaluation said that they have possible dyslexia, and I'm confused. And then the parents are left to try to figure out and put those pieces together. And I think that, you should do that with a team. So when you come to our clinic or you get a private IEE, an independent educational assessment, you get that. You get a comprehensive assessment that combines those things together. Let's see. And then there's a sample about how do I request an IE through a school district. And I think, Teresa, correct me if I'm wrong, but that's also available. You guys can email that to some of the parents if they request that, correct? Did I lose Teresa?
Yes, they can. They can email our office. It's also, I'll put in yes, they can email our office. It's also part of Disability Rights of California. We pull the information and I'll put that in there as well. But either way, I'm sure.
Perfect. So that is definitely one route to go. Now, I don't want parents to think just because they requested an IEE for psychoeducational assessment, then they can see somebody like me, no questions asked. Sometimes they do have questions. This district does give pushback, not all the time, but sometimes the district will say, our report is good enough, and there might be discrepancy, right? Where the district is feeling like, yes, our report is good enough. And the parent is saying, well, but this doesn't really capture who Johnny is, per se. This doesn't really, I feel like the school is not really understanding what his true abilities are because of the way that the assessment was conducted or the types of assessments that were conducted, or if the child has so many different things going on, whether it's like autism and learning difficulties and ADHD, et cetera, that we really need someone who is an expert in this to be able to understand it. When that discrepancy happens, oftentimes parents will connect with special education attorneys. And you can reach out. I'm happy to share some resources. I know that Teresa at the Family Focus Resource Center also has tons of resources of special education attorneys that they utilize to help with this process. And then that particular special education attorney can help hopefully get your child access to an IEE. Obviously, it's not guaranteed, but it's a case-by-case type of situation. Okay, let's see. All right, I think now is a good time to move on to talking. Oh, this is a sample letter. Yes. So the sample letter is there, and you would just basically, this is just a sample, so you don't have to write exactly what it says there, but it's a really good template for you to utilize so that you can inform the school in writing what you're requesting. And notice how there's dates on there. That's really important. I'm not an attorney, so I don't know all the legal dates, etc. So, and I don't want to give you guys false information, but there's a specific timeline from the time that a parent requests the IEE to when they have to respond, and how they have to respond, and the reasoning that they have to give to granting or not granting, etc. So take a look at that. Again, it'll be emailed out to all of our participants as well, and you can contact the Family Focus Center for that information as well. Teresa, did I leave anything out about that? You're on mute, hon.
Trying to cover a lot of different areas, so
Okay.
yes, they can email our office, and I just put our website information in the chat box, because depending on where area you're in, which office you will call, and I will even upload actually our brochure, and you can take a picture of that or write down some information on the offices to contact.
Wonderful.
So is this your next slide? You have one more? Oh, here we go.
So yeah, one more. And then I see you guys have awesome questions in the chat. We're going to have time to go through the questions.
Yes.
If you think that's the important part here. So Olympia, if you don't mind giving us a little bit more insight from a parent's perspective, because I know you recently, about a year ago, went through a psychoeducational assessment with your daughter, right? So you want to talk a little bit about that experience?
Right. So Essie was diagnosed at, I want to say she was 4.5 when we first got her diagnosed and got her assessed. And up until now, she's only had IEPs. And I didn't even think it was a possibility to get her reassessed, to get her reevaluated. And so about a year ago, in December, we went to Dr. Aggie and we had Essie reassessed and reevaluated. And when I say I really didn't think this was a possibility, I didn't think that there would be much of a difference in getting her reevaluated. We had to get her reevaluated for insurance purposes. So our insurance company needed us to do it. And I didn't know that we could do that. So when we went to Dr. Aggie, she spent 2 days, I think, right, with her. It was about 2 days, as he was really excited for the first day, because it was during COVID and she hadn't interacted with anyone. It was like the first time she was seeing anyone, and she was really excited. But I remember getting the assessment back from you, Dr. Aggie, and it was as if I was meeting my child for the first time. I'm gonna try not to get emotional because I have to control myself, but IEPs and assessments at school and all these meetings, they kind of, parents, I'm sure you guys will understand this, they kind of talk about our kids like just the diagnosis. I don't know, that's been my experience. But after we got Essie's assessment back from Dr. Aggie, I got to know Essie. I was told that she can read, she will be able to read, she will get out of a diaper, she will be able to communicate with you. Things that I did not think were possible for my daughter. I found out what interests she has. It's so sad to say, but I didn't know my own child. I really did not know my own child, and I can admit that. I can say that I also was treating her as if she wasn't able and wasn't capable. And so with reassessing her at age 9, I was reintroduced to my daughter. I was reintroduced to all the things that she can do and all the goals that she can reach and all the progress that she can actually have.
Mm-hmm. Mm-hmm.
Does that make sense?
Yeah, definitely.
I know it's sad to say, she's my daughter, she's 9, I should know my child, but all of us parents know how hard it can be to connect. I've had difficult times connecting with Essie, and with getting her reassessed was the best thing I ever did. We know Essie on a whole new level now. And once she figured out that we know her, she also began to open up more. Her eyes would light up when we would talk about her interests. I don't know, it was like magic. I I was a wreck for so long. I couldn't admit that it took a reassessment to get to know my kid. I couldn't do it on my own, and that's fine.
Mhm. It really does take a village, right? And I think, thank you so much for sharing your experience, Olympia. But, I think parents often, think that, okay, my child has a diagnosis, I'm good. What more can I get from a comprehensive psychoeducational evaluation? They're going to tell me again that my child has autism. I already know that information. And what you're sharing is that you can actually get a lot from that experience. And one of the things being, you're getting to know your child at different stages in their lives, right? And I often get this question of, when should I have my child reassess? And I don't know if I talked about that already or not, but I'm just going to talk about it now. And there's different reasons and different times that you would get these assessments, right? So in the beginning, early intervention is really important, as everyone who's watching probably knows, right? So you want to make sure as soon as humanly possible that you have a comprehensive psychological evaluation early on to get that diagnosis and to get an assessment of your child's cognitive, that's their intellectual abilities, their speech, their sensory-based functioning, as well as their psychological well-being, right? So that they can get access to intervention, because if they don't have the right diagnosis early on, they can't get the right services. So it's the same thing like in the medical world, right? If you don't have the correct medical diagnosis, you're not going to be able to take the correct medication. So the two have to match. So early on, that's very important. And then I would say it's really important every time there's any major transitions in a child's life. So they're going from daycare or preschool to kindergarten or first grade. They're going from elementary to junior high, or junior high to high school to college. So any major transitions. So those are the two. The number one is early intervention. Number two is major transitions. Number three is anytime there's any kind of big change that occurs in your child's life, whether it's some kind of trauma, whether it's some kind of any kind of big change where they're experiencing, it could be loss, parents getting divorced, parents reuniting, whatever it might be. It's always good to reassess and reestablish where your child is at, so that we can better understand how to provide assistance and further help them. A solid, good, comprehensive psychoeducational assessment, it allows, like I was mentioning before, it gives you a whole perspective of your child. So you're not having to put those pieces together. And I think that, every child and every parent deserves that at the end of the day. You shouldn't have to put the pieces together alone. You should have a team of people helping you put those pieces together. And sometimes, taking the time to invest in those assessments, whether it's, funded by, privately, or it's funded by the district, and doing our due diligence to getting that done through the district is important, because you do end up getting a lot of valuable information that you can use in multiple areas. And so I think that's a key factor here. What do you think, Olympia?
I agree.
Yeah. Okay, very good. Should we move on to some of the questions that people have? Teresa, do you want to read the questions, or how do we do this, hon?
That's totally up to you. There's one here. If you want to take it, it's totally, would you like to?
Sure.
Okay.
Is this assessment during structured time only? What if LAUSD refuses an IE? Where do we turn in the written request at an IEP meeting or anytime? Okay, so great question. So the assessments are usually done during the week, and usually a child has to most likely skip school for that assessment, and the assessor can give a letter to the school saying why they are missing school. Now, it's important that it's done during that time and not after school for the most part, because we do a lot of strenuous testing during that time. And so the kids kind of have to be at their freshest. So we don't want them to come after school when they're tired and and have had a long day of learning, and the last thing that they want to do is answer questions for us. So it does have to be during that kind of time. Now, for definitely 1000%, I've had kids who are able to sit, in front of a desk and do testing. And then there's kids that I assess that can't do that. And that's totally fine. And when they can't do that, guess what, guys? We're on the floor. We're going on walks with them and the parent. I'm asking questions while we're walking. We're on the couch. I've had a kid that once he was so overly stimulated by the lights in my office that we actually turned off all the lights and we used mini flashlights to get through parts of our assessment because it was so overly stimulating for him. So it really, when you get a good comprehensive psychoeducational assessment, because we could do the assessment anywhere in any format while keeping it as standardized as humanly possible, we can get creative versus when they do the psychoed at school, it's limiting because they have to kind of do it where the educator is available during this time. So they pull a child out of class to do the testing, and then they put the child back in class. And if there's anything that we know about children who have autism is that transition and that change is really, really hard. So already they're used to a certain routine in the classroom, then they're pulled from that routine to have an to do this assessment. And then they do small pieces and parts of an assessment. So you can't even base it off of, is the child, like, what if the child had a bad day that day, but you had like 5 mini assessments on different days? You would never know, was it a child was just having a bad day, or is that really an area that they're having a difficult time in? So that's so for all of those reasons, which is why doing it at office during structured time is so important. The next question is, what if LAUSD refuses an IE, which they absolutely can? Any school district can refuse an IEE. That's when you would get in contact with the special education attorney. I'm not saying that you would have to hire a special education attorney. You could also just have a consultation with them. Many of them are willing to share information and resources, and then from then decide if you want to retain an advocate. And it doesn't have to be an attorney. It could be an advocate. It could also be a parent who's gone through a similar thing. You can just reach out to different people. The other question is, where do you turn it in? You don't have to wait for the IEP meeting at all. You can turn in the request at any time, but some of the amazing attorneys that I've worked with in the past have said you always want to allow a district to conduct their own assessments first, because legally they have to, because basically they have to do their own assessments, and then we have to say why we don't think it's a good representation of our child or why it is. So they have to do their own anyway. So if your child does not have a psychoed assessment done by the district ever, you want to make sure that they do it first. And maybe it's a great one, and maybe you don't need an IEE. It's really case by case and child by child type of situation. Okay, I hope that answered the question there. There's, how much does it cost to do an assessment? So a cost for an assessment can range anywhere from $5,000 to $7,000. When it's covered by the school district pays for the whole thing. And there are, just because I think information is powerful, right? So as parents, you guys should know this. There are opportunities where, let's say you didn't know about an IE, or you really wanted an assessment. So you hire someone like me or somebody else to have a private assessment done, and you pay out of pocket. Then you go back, and then you later on have an attorney. You can work with that special education attorney to see if whatever they did, if, how do I say this, to basically prove a case of the assessment that was done at the school district was not an accurate representation of your child. And then they will offer some type of potential reimbursement for the assessment that you've already paid for. Now, none of this is guaranteed, of course. So please don't say, Dr. Aggie said you can do XYZ, because I did not, but I just said that is a possibility. And you should definitely consult with a special education attorney or a special education advocate to get more information. And of course, like I mentioned, at the Family Focus Center, they have tons of resources and information for different advocates and different special education attorneys that could provide you guys with more insight into with the legal aspects of it all. Okay. You're welcome for the information. Does anyone have any other questions or anything else that you guys wanted, Teresa, that you guys wanted us to touch up on? Oh, you're on mute again.
I know there's a family that could not make it that wanted to know how often, if you know, how often a family that requests an IEE actually gets that from the district through remediation, or does it always have to go to due process? That was one of her questions.
That's a really good question. And I think it's case by case. You know, I don't have the stats on that, but I think it's case by case and by district. There's some districts that know for whatever reason they weren't able to get an accurate assessment of the child because of their behaviors, or maybe they didn't have the tests that were needed for the assessment. So they may, without a parent even requesting it, say, you know, we should probably get an outside expert to do this IEE, and then they'll contact me or somebody like me to do the assessment. And then there's times where it has to go through due process, and there's times where parents just put in a written request and put in the reasons why, and you know, they make that happen. So it's really case by case. I know that's probably not the answer that they were looking for, but it really is case by case and district by district. Okay. Are there any other questions that anyone has? Okay, since nobody has any other questions, Olympia, is it okay if I ask you a few questions?
Sure.
Okay, so what information, as someone who's gone through the psychoeducational assessment process, what information could you give the parents that are watching that could help prepare their child for an assessment, or for them to prepare? Because a lot of times families have no idea, and rightfully so, like how much time goes into an assessment. And they're like, what? You want my kid in there for how many hours? Like, I get that a lot, right?
Right.
And so what's the information that you can give families to kind of prep themselves as well as prep their child for the assessment?
I think you need to definitely treat it like any other day. I remember being very nervous, extremely nervous, and SE feeds off my energy. So you definitely want to make sure that it's like any other day. You're not rushing them out the door. One thing that was helpful for us was that we packed Essie her favorite snacks, because something that motivates her is her snacks. So we tried to prep her in advance. I talked to her about it. I was not sure at that time if she even cared. But definitely treat it like any other day.
Mm-hmm.
So that they can perform, basically. I don't think perform's the right word, but they can feel comfortable and be themselves.
Mm-hmm. Absolutely. Another like question or concern that I get from parents often is
the overwhelming feeling.
yeah. Yeah.
Hard. It's definitely very difficult to see your child being pushed to certain, levels. It's hard to watch them cry. You want to constantly jump in and stop the assessment when your kid is crying. You want to make excuses for your child and say things like, she's not usually like this. Oh, she responds much better to this when it's just me and her. Or the biggest favor you can do your child for your child during an assessment is to butt out. Just stay quiet, butt out, and try to keep it together. I completely fell apart during our assessment on the second day. I just couldn't take seeing her cry anymore. And it's not an easy process. It's not a walk in the park. Your child is going to get pushed. Their boundaries are going to get pushed. Their buttons are going to get pushed. They're gonna have a tantrum. They're gonna cry. They're gonna beg. It's not easy. It's not easy, but it is so worth it. I know it sounds like, oh my God, but we're strong. We can get through it. I got through it. But the best thing you can do is just to back off and let the assessment happen without interfering.
Definitely. Definitely. Thank you for saying that. I know it's, every child has a different assessment experience. And I know that I've had parents say, well, I don't know if my child is going to be able to give you the same results that he would give me, or give you the same responses that he would give me. And my response to that is, we kind of want to know how he or she's going to respond when asked by another professional that they're not, close with, because that's the real world. So if Johnny is going to respond a certain way with me, then more often than not, he's going to respond a certain way with the teacher, the similar way with the teacher, or with the speech therapist, or with the occupational therapist. And it's important for us to have that baseline, so that when we are working on things, we have that baseline to compare and to see, what kind of progress our child is making and where we can go from there.
Right. That's the point.
Absolutely. There's another question. We had our son evaluate. Hold on. Oops. Okay. We had our son evaluated at UCLA with our insurance and had and he was diagnosed with ADHD and high functioning autism spectrum disorder. We had 2 IEP denials despite advice from our evaluation, and he needs educational supports. Do we need an IEE, and would that help? Absolutely. That is, if you have a comprehensive psychological evaluation from UCLA with those diagnoses of ASD and ADHD, and the school is not recognizing that, that is a huge red flag that you should absolutely consult with a special education attorney, or give me a call and we can work through that. Because remember, guys, this is really important. Just because your child is getting good grades does not mean that they don't need an IEP. A lot of times, parents are given the information of, oh, Johnny's getting A's and B's. He doesn't need an IEP. He doesn't need services. Don't even worry about that. But just because he's getting A's and B's does not mean that he is meeting his fullest potential. Okay, like just recently I assessed a kiddo, and he's twice exceptional, which means he has special needs, but he's also highly gifted. And the school did not want to originally give him an IEP because he is getting A's and B's. But from a social perspective, he's doing really poorly. So we had to, through a comprehensive independent educational evaluation, we had to show the school district that in fact, he does need an IEP under a special education of autism. And these are the reasons why. There's actually, again, I'm not an attorney, but there's actually legal wording about, and Teresa, you can chime in if I'm wrong about this, about how grades do not necessarily equate to the need of an IEP. So it doesn't, it's taken into consideration as part of understanding the child as a whole, but it's not a factor and a reason for having an IEP. And that's, yeah. Okay. Did you have anything you wanted to add to that, Teresa, or you're just okay, cool. Let's see, is the cost of 5 to 7 including FBA, speech, OT, visual, etc.? Is it just one day? What if he behaves differently with you one-on-one versus in the classroom with distractions, or has behavioral problems with peers? So very good question. So like I mentioned before, you can have an IEE for behavior, IEE for OT, IEE for speech. So that cost is just the comprehensive psychoeducational piece. Now, every assessor, every psychologist does it differently. My approach is very comprehensive. So when I do an assessment, we try to get an observation, at least 1 or 2 of the child at school. I know during COVID that was, we're kind of still in COVID, but it's still kind of tricky. But we try to get an observation at school. We get teacher rating forms. We get parent rating forms. If the child is getting ABA services or speech services, we have interviews with the ABA therapist. We'll have parents like send us videos of a child interacting with another child at the, like at home or something like that, or at their family dinner and different things like that, just to get different glimpse of how a child might be. Because usually, especially, like, I'm not just saying especially with me, but people who have a strong behavioral background like I do, I usually can work well with a child who has behavioral difficulties because I implement behavioral strategies in my assessment. So for example, we'll have like token economy chart, right? And so every time a child answers a question, we'll do an X or a smiley face. And then when they have 5 smiley faces, then we take, an iPad break, or we have a snack break. And so we do things like that. So more often than not, they probably are going to do well or better one-on-one. But then I will take that information of how well the child is doing one-on-one, compare it to the information from what the teacher's saying of how they're struggling at school, and come up with a plan to present at the IEP meeting that helps the team understand how the child learns best. So, for example, when things are difficult for Johnny, it is better for him to have the information presented one-on-one, do a check-in, make sure he understands it, and then he rejoins the group for the lesson. That was just an example, because we learned through the assessment process that that is how he learns the best. I hope that answered your question. Okay, the teacher says he's fine and doesn't need any support. The school says it's getting access to the curriculum, and he's getting access to the curriculum, and they don't provide anything for him. So yeah, definitely, Petra, I would for sure send me a DM or email me, and we can definitely talk a little bit more. I find it very, very, very impossible for a child who has autism and ADHD, as high functioning as they might be, to completely access the curriculum independently without any support. I feel like if they have those areas of continuous growth, that there's something in there that the school can do to further enhance their abilities. And again, we're not looking for a child to give us minimum access to the curriculum. We want them to be able to access the curriculum at the best of their abilities, whatever their abilities are. And so that's important to note. Okay, any other questions?
Yeah, we have about another 10 minutes, so this would be a good time for more questions, or if there's more you would like to add to this, Dr. Aggie and Olympia.
We can, let's see, any other additional information?
I think for Olympia, the question would, I think for some parents, is that once you receive the assessment and, with that assessment and certain things that were put into place, I'm just curious, did the school ever really was surprised as well or did a teacher pull you aside and go, yeah, thank God you got that, because now they're even seeing some differences, or they just thought everything was okay?
No, we had I believe it was an IEP meeting after she got her assessment, and they were all very excited. One of the teachers mentioned that, they always knew that she was capable of more. They were all very excited, and the main thing that they were excited for, besides Essie's growth, is it was very organized. The goals were very clear, and they were very hopeful that she could reach those goals. They were excited for her. They were very excited. Yeah.
It seemed like during the IEP meeting that we had, at least the one right after the assessment, like I, at least as an assessor, felt like, and again, she had an assessment when she was 4.5, and she had not been reevaluated until she was 9 years old. So
wow, I didn't know it was long.
And the thing is, I think, Teresa, correct me if I'm wrong, but I think like a lot of parents don't know that they should get their child reevaluated. They think, right, Olympia?
I didn't even think that was a possibility. I mean, that is the best.
No, most families don't know. Yeah.
And I don't know why.
I have no idea.
And I don't know why they don't tell families that from the beginning, right? Like,
hey, you can do this.
Yeah.
It only makes sense because she grew up, she changed, she got older, she developed more, or she regressed, whatever it is, we're human beings that change constantly, right?
Absolutely. And it's like she's more than just her diagnosis, right? All of
Exactly.
our kids are. All of our kids are more than their diagnosis. And so why would we just treat them, oh, they have autism, so then putting them in this category and that's all that they can do, right? It's like there's sky's the limit, right? And the only way that we know what they can do is through these assessments and getting, because sometimes they know a lot up here, but they're not showing us that, right? And so with these assessments, we're able to get a better insight in terms of what they know. And like I was saying, I remember the IEP meeting that we had for SC after the assessment. It was like I was looking around the room and everyone was like, oh, yes, she can do that. That's right. She does say 4 to 5 words together. And it was just like all these light bulbs. I'm like, yes, where was everyone during this time? And it was incredible to see that. But I think, the assessment also gives the educators and the therapists like another boost to continue to guide and nudge the child in the right direction, rather than for them to be stagnant of, oh, this is what she does, this is all she's capable of, which is so not the case for most of our kids, especially Essie, as she has shown us, right?
Right. There's a question for me about SC.
Yeah, there have about three questions in there. You're right, Olympia, I think the first one's for you.
Because when you said that Essie was not going to talk, when did she start talking? So talking and communicating. Essie was not communicating with me whatsoever. She was not communicating her needs. She was doing a lot of scripting. So that means she was saying the same sentence, repeating the same sentence, whether it was from a cartoon that she watched or a phrase of some sort. So it was a lot of scripting, and there was no communication whatsoever. She never told me when she was hurt, when she was hungry, what she wanted to eat, where she wanted to go, what she wanted to wear, if she was uncomfortable, how she was feeling. There was no communication up until this past year. She had words, lots of words, of course, but it was no help to her or me, the words that she was using. It was, she kind of, after her assessment, found her own voice. So when I say talk, I mean, she's had words. It was just never used to communicate, to communicate her needs. Now, she'll just walk in the room and say something and tell me, hi, mommy. And she never addressed me as mommy before. That is brand new. That is this past year. And after that, this last assessment, this past year has changed so much. I mean, she wasn't, there was no new goals for her. There was nothing new for her. And so with the new assessment, we got a new speech therapist, and she's now nonstop communicating. Sometimes it's too much. I'll just maybe make it a little funny. I was changing and she walked in and saw me and she said, oh, look, a baby hippo. She's really sarcastic, and I know that I've gained weight. Like, thanks, Essie, for stating the obvious, but she's so funny, and I never knew how funny she was. And I'm like, she's not wrong. I mean, where is she wrong? And sometimes when she gets upset with her ABA therapist, she'll say, oh, look, a witch, a vampire. She uses the funniest words to insult them. It's so adorable. She never did anything like that before. It was just, bursts of crying and tantruming, and there was no communication. Her behaviors have calmed down so much more now that she can communicate. But yeah, with Essie, I mean, every child is different, but with Essie, she started communicating this past year.
That's wonderful.
Do you see there's one my son has, do you see that one?
Yes, so my
Okay.
son has ADHD diagnosis from the pediatrician, moderate autism from regional center. How do I test for high functioning autism? I know he's good academically, but is not, and he can't sit and focus on his classwork, but does very poorly socially. Is it important to get him a high functioning label? Does it change anything? I think it's important to get the diagnosis that matches your child's abilities, and only because that will help them get access to treatment that they might need. To me, from reading this, it sounds like there's discrepancies between what your child's abilities are and what the school is offering. So I definitely think it's important for a psychologist, whether it's me or somebody else, to have another gander and look to see from a comprehensive perspective what his needs truly are. Okay, so I guess that's it for today. Again, you guys can email us if you have any questions. This was so
I'm going to
much
go
fun.
back to your, let's just give them a minute to go back to your
Sure.
information. And, I do think, just for a parent's perspective, the outside evaluations, I think, can be very helpful, because I kind of think about sometimes if you go to the doctor, say they give you a prescription, they give you a medicine, something, and it's not really, treating the area, nothing's really happening with it. You wouldn't keep taking that same medicine. You wouldn't keep doing the same, the same thing over again. You go, okay, maybe something else is not right here. Maybe we need to have another appointment discuss. So I don't think an assessment is one, as always, from the school district, one size fits all. That sometimes maybe it's okay to bring in someone else to look at it differently. And I think there's a way you can do that. Maybe with the school district, it doesn't have to always be adversarial. We all want to get to the right place, but I think the more you know before you go into asking the school district, because it's about data, they want to know, keep your notes, make sure you're just not kind of talking off your head. Do the homework and have it together, because that's how, when you're going to have those meetings, maybe with the mediation, they don't always say no to these, because you wonder sometimes, well, how did that family get their independent evaluation through the school district? Just do your homework, keep all your paperwork, those phone calls, those notes coming home that they're not able to sit down, they're all over the place. That's huge red flags right there, that something may not be working. So that was just my 2 cents.
And
so thank you, everyone.
Teresa, I do love what you said about keeping notes, not notes here, but actual notes.
Yes.
And the reason for that is because you need proof of everything that you ask for, unfortunately. And so as parents, sometimes like, oh, the proof is in her actions or in her, the grades, et cetera, and it's not. You have to write down the things that you're seeing, keep track of any emails that the teachers are sending. So if a teacher's sending, oh, I've noticed that Johnny's behaviors are getting worse this past few months, or, whatever it might be, just anything that could, it doesn't have to get litigious like Teresa was saying, but anything that would support what you're seeing and support what they're seeing and have that documented is only going to give you more information and more insight with what your child needs. So wherever you go to, whether it's, I just as a parent want to understand my child more, so I'm going to go get an assessment with Dr. Aggie, or it's I need everyone else to understand my child the same way that I'm understanding them. So wherever you go, the more information that you have documented, the better it's going to be for you.
And with us at Family Focus, for years we've had this binder that you would keep all your information in one place. Now we have an online version of the information that actually went into the binder, but you can go to like the 99-cent store, wherever, just get a little binder, folder, start putting that information in. And today I actually sat on a resolution conflict webinar today. It was really interesting. And some of it is about with the school district and how to get to the place that you both can agree on what's best for your child. And so there are steps to that. I'm hoping down the line, we may even add some of that information to our notebook. But my girls are older now, and I had to go through a lot of certain things with the school, not nothing that was very adversarial, but it was just always just about someone listening. We want to be heard. You just want to be heard. You don't want to be, you feel like you or your child or everyone's just in a box, in a particular box, and everyone's the same, whatever. As especially when it comes to certain diagnosis, someone with autism can look totally different than someone else. But I think that's what it really is going to take. And I know that these different IEEs can be done more. So we're here to help. And I thank you so much, Olympia, for sharing your story, as well as Dr. Aggie for tonight's presentation. Here's information here for Dr. Aggie and Olympia. And I put our information in the chat box. And if you signed up for this webinar, you have our Family Focus information as well. So please continue to check out the Family Focus website, because we will have more great webinars like this to come for 2022. And if you can think of certain type of webinars you would like, please just email us, go onto our website, and give us some suggestions. So with that, ladies, thank you so much. And if you want to close it out.
Thank you, guys. Thank you so much for having us. This is fun.
This was great.
Thank you.
Good night, everyone.
Good night. Okay, stop recording.